What's this new coronavirus? Stay tuned to find out. What's up guys, my name is Edgman and I'm a 4th year pharmacy student, and I enjoy making these videos about common questions patients have about medications or any healthcare related topics, so make sure to subscribe for more content. Now to the rest of the video. Let's talk about the coronavirus. A coronavirus is actually a family of viruses that's typically coming from animal to human contact, meaning that usually animals have their own illnesses and viruses that's only susceptible to other animals. But when a virus mutates or changes that a human is susceptible to illness, it's considered a part of the coronavirus family. And the 2019/2020 coronavirus hasn't really been named, so that's why you're hearing a lot of like coronavirus in the news. But in a couple months or a short amount of time, they should have more information on this virus, and then they should also name it like a specific name, because there were 2 other viruses recently within the past couple of decades that are from the coronavirus family, and we'll briefly talk about them. It's called MERS and SARS. So the most recent before this current coronavirus was called MERS, and MERS stands for Middle East Respiratory Syndrome, and it was first identified in Saudi Arabia in 2012. And through genetic sequencing, they found that it came from camels. Now, dating back even further, the other coronavirus was called SARS, and SARS stands for Sudden Acute Respiratory Syndrome. And through genetic sequencing as well, they found that SARS originated from civet bats. And both of these coronaviruses, their symptoms were relatively non-specific, meaning that patients had cough, fever, shortness of breath, fatigue, and these are generally non-specific symptoms for like a specific disease state. So identifying and diagnosing patients weren't as easy as like when you have hallmark symptoms like, for example, Lyme disease. Now that we talked about the previous 2 coronaviruses, let's talk about the coronavirus of 2019/2020. So this coronavirus was first originated in China. However, as of today, cases have been reported that it's been in California, Washington, Arizona, as well as Illinois. Now, the concern for this virus is, and why you see it so much in the headlines, is that it's thought to be human-to-human contact, meaning that previously we talked about in this video how it originates from an animal to human contact in which the virus mutates and that human got the animal virus. This is an issue because human-to-human contact is now a potential transmission opportunity for this virus to affect other individuals, and this is why it could be a possible epidemic. Now, through initial genetic sequencing, scientists have suspected that this coronavirus came from a snake species. And in regards to treatment, right now there is no formal specific treatment on coronavirus. What you do if you get coronavirus is when you go to the hospital or you seek medical attention, they basically give you supportive therapy. Meaning, like, if you have a fever, they'll give you acetaminophen or something that will reduce your fever. If you're having trouble breathing, they'll put you on a ventilator, or they might give you a medication to help you breathe. Or if you're like dehydrated and you need fluids, they'll give you fluids. There's no specific medication in terms of to treat the coronavirus because healthcare professionals don't really know too much about the virus, and they're not going to give you unnecessary treatment. Currently, companies are working on having a vaccine developed for this coronavirus to help vaccinate patients. And if you have any questions about how a vaccine works, check out my other video which I made about how the flu shot vaccine works, which will kind of be in the same lines of how the corona vaccine would work as well. Now, what does the CDC recommend now? Currently, the CDC has recommended against non-essential travel to China because that's where the virus originated, and there's a lot more people in China that are infected currently than in the United States. As well as if you're around anyone that has the coronavirus and you do develop these symptoms with like fever, cough, fatigue, and you have a suspicion that it might be coronavirus, to seek immediate medical attention. Now, I do wish there was better news on the coronavirus, such as a potential vaccine or potential treatment. However, I thought it would be good to make this video to give you guys a little information about what the coronavirus is and things you can do to help prevent the transmission of it. If I get a good amount of views on this video, I'll make a follow-up video on the coronavirus when there's more updated information on it. But other than that, I hope you guys really enjoyed this video. Please like and subscribe to my channel, and I'll see you guys next time. Thanks.